name's Ailsa and I'm a medical student, and I'm here to talk about the first section of the UCAT, which is verbal reasoning. This is basically like a comprehension task in which the UCAT board want to see you critically assess pieces of information and then to make some judgments about them. This section is probably the most time pressured, as you have about 21 minutes to do 44 questions, meaning you have about 28 seconds per question. The format is you'll be given a series of passages, around 11 passages, and asked to answer 4 questions each on each paragraph. The paragraphs are normally about 200 to 300 words each, and the whole point of the verbal reasoning is, as a doctor, you'll be presented with lots of information. That might be patients' notes, that might be scientific journals, and then you have to make a judgment call on them after reading quite a lot of information. And obviously, being a doctor, you're seeing lots of patients, there's lots of work to do, and you can't spend hours and hours reading and digesting. Sometimes you have to, skim read, digest a lot of information at once and make judgments about them. So these passages will be on absolutely random things. They won't be, scientific journal articles. They won't be about patients' notes. These are just, maybe about a historical battle or a football game. And that means that you do not have to have any prior knowledge on, random facts, history or geography. But that means that if you do have any knowledge on, say, a specific football game, you need to suppress that, because the questions might sort of trick you into making judgment calls if you had prior knowledge on it. So that's basically the format of the verbal reasoning section. Obviously, the sort of catch of it is that you're going to have to read these passages pretty quickly in order to answer the questions. And all the tips and tricks will be about how you can quicken that and make quicker judgments, or sort of hone in your critical thinking earlier on in the process, rather than, everyone can read and everyone can answer questions, but not maybe in the time that they give you very efficiently. So each passage will be accompanied by around 4 questions, and those 4 questions can come in different styles. So one of the first ones, and maybe some could argue the easiest, is the true, false and can't tell questions. So you will be given a statement, and obviously once you've read the passage, or as we go on, you can read the questions first and then look at the passage. You will be given a statement, and then from that statement, either from reading the passage before or reading it as you go along each question, you'll have to answer whether this passage supports the statement, doesn't support the statement, or actually the information is just not given. Now, I think a lot of people start thinking, can't tell will not be a very popular answer, but I think the UCAT seem to like this question, because it's a bit more difficult in the sense of you have to find that explicit piece of knowledge, or you have to find that explicit piece of information that is directly contradictory. And a lot of things that sort of trip people up is that there's a lot of qualifiers and things to slightly change the meaning of a word. So instead of always, they use sometimes instead of maybe. There's sort of words like that, but I'll go on to them later. And then the other style of questions are according to the passage. So you'll be given a statement, and then you'll be given 4 follow-on statements, and you have to assess whether in the passage which is the most likely statement to be correct. Then there's also accept questions. So every single you'll be given 4 statements, and every single one of them will come up in the passage bar 1. Again, this might require a bit more time and skim reading, because you have to see that every single all 3 of those statements are in the text, rather than just finding one statement. And then sort of the final style of question is the most likely, and I think you could argue this is one of the most difficult style of questions because it's a bit more, I think you're using your critical thinking a bit more in this style of question, as you are having to make a judgment call on what is the most likely. So all of them might be slightly correct, but what has the most weighting and backing behind it from the passage. And that might include sort of maybe what is the author's opinion, and might have to assess the tone of the passage rather than just reading it at face value. So that's the style of questions. Now I'm going to go on how you can maybe tackle that in the most time effective method. There's two ways that you can approach the verbal reasoning, and know which way is correct, but some may appeal to others more than, one way might appeal more to others. And the whole point is that you have to sort of reflect and think, where do my strengths lie? So for me, this section was one of my strong points because I already was doing sort of critically thinking A-levels such as history, where I was used to reading lots of books, texts, and then creating an argument, whereas maybe the quantitative reasoning for me didn't really play to my strengths. I wasn't maybe as natural as maths, but it did mean that one style of answering the questions appealed to me more, which was I read the passage completely because I actually was quite a fast reader and was quite good at picking out key points anyway, and then I answered the questions. The other way is you read the question and then you look at the passage. Now, either way is correct, but some, as I say, it might appeal to you in a different way. If you're a fast reader, reading it might be completely good, whereas if you want to be a bit more, if you're a bit more aware that you can't read that quickly, the other method might work better. The way of doing it, where you read the question first and then the passage, has a sort of cool sort of way you can set it out called the keyword method. Now this is suggested by quite a lot of other channels, other resources suggest it, and the whole point of it is that you read the question and you see that there might be a keyword. So a really good way to start is thinking of names, dates, anything in a capital letter, a city, maybe if it's about politics, an act or a bill, and it might come up a couple times in that text. And what you do is you find your keyword. So say if it's 1996, because it's talking about something that happened in 1996. You then look at your text, you skim read, you clock 1996 appears twice. I will read the sentence before it, that sentence and after it, again before the sentence and after it. Don't just read 1996 in isolation, you have to sort of get the context of it, because also might be a contradictory sentence below it. So just to reiterate, you pick a keyword, you look for it in the text, you read the context around it, and then answer the question. There is a few pitfalls to this, as in if it might be contradicted earlier or later in the text, what the sentence is. You might pick a keyword that actually appears like 5 times, and that therefore pick a different keyword. If say 1996 appeared 5 times in my text, I'm not going to save any time by picking that as a keyword. Move on, pick a different one. Also try and think of ones that there might be a synonym for it within the text, or it might be like money or dates might be a bit different within the text, so just look out for that. And finally, if there is a sort of sentence about what is the most likely, or from the text, what do you think the author's opinion is, they tend to be more conclusion part of the passages, so maybe the final paragraph, and therefore it might just be easier if you've got that, just skip to the bottom of the passage and see if there is an opinion or a summary statement given, and that actually might save you time. So as I say, you've got 2 ways of answering the question. That's probably the easiest way to divide it. Maybe from the We Are Medics UCAT ebook, there is a link to our website where you can actually test how fast you read, and it might be really interesting and helpful to use that tool. see how fast you can actually read. And if it's not quite, if you realise you've got maybe a long way to go to fit in, 44 questions in 21 minutes, then you need to maybe go to the keyword method. Or you might want to use a mixture of both. We're only here to give a bit of advice, and then from it you can decide what would suit you more. And finally, I'm going to go on to maybe some pitfalls and how to prepare just mentally, as this is the first section of the UCAT. So you want to go into this section feeling confident, calm, collected, but also ready to, work really quickly, because it's definitely not easing you into the process by giving you such time pressured questions. So some sort of things to watch out for, or common pitfalls in this section is, well, there's a few things. First of all, this is very time pressured, and maybe you have to pick your battles, as I said earlier, the ones that are like most likely, where you have to the most likely ones where you are given 4 statements and 3 of them are correct and 1 isn't. You're going to spend quite a lot of time compared to maybe a true, false, can't tell statement question if you have to find 3 different statements within the text. So there is some places out there say just do all the true, false, can't tell questions first, flag up the ones that are longer and come back to them. I think that's maybe too general and might waste a lot of time by flagging, skipping to and from questions. But if you realise I'm spending a lot of time on a question, flag it and move on to an easier question. There will be easier questions, they're not all hard. And therefore you're going to maximise and utilise your time. As I said earlier, you do not need any previous knowledge, therefore do not make assumptions. If you know who won this particular battle or won the football match, if it doesn't say that in the passage that this football club won this game, and you've got a true, false, can't tell, don't say true or false. You can't tell. And that's a pitfall, because people do sometimes, there is a passage where people do know the answers. I think there's a few out there that talk about fruit, and if it doesn't explicitly say that banana is yellow or an apple is this colour, then you're making an assumption using outside knowledge and therefore might be wrong. And then finally, there is quite a few, they try and add some sneaky words, what you can describe them as absolute or qualifiers. Absolutes, which I did speak about earlier, and qualifiers is, never, always, versus, sometimes, maybe, and they do change the meaning of the passage. They might change the most likely question, or they might, a statement on a true, false, can't tell might explicitly say, bananas are always yellow, and if there is a sometimes in the passage, or rarely, if it said something like bananas are rarely green, well, that means there is a potential that they are green opposed to always being yellow, and therefore it's false or it's can't tell. So please watch out for those words, because they are the thing that could trip you up on this. Like every other section in the UCAT, you have the sort of keyboard to, skip, to flag, to come back and forward and utilise that, because as I said, it's time pressured. That's the section that you want to be using this function for sure. Finally, how to prepare for this. Well, you've been preparing in many ways from childhood. You can read, you can do comprehension tasks, but this is obviously a step further. So I'd suggest, We Are Medics does a UCAT book. There's everything and most of the things I'm saying is from that book. Use that, and maybe use the speed reading tool just to assess where you are. But what I'd say is, so there's passages like the scientific journal articles that you could read, that you can, try and skim read them. Even just reading a book or another passage or a newspaper article, skim read it, but maybe then ask say to your mum, can I summarise this passage for you? Or maybe you could pair up with another person who's doing the UCAT, or a family member or a friend, and be ask them to maybe say, okay, they may reread it and say, okay, well, I want you to find this statement, and then you go skim read it using either speedy skim reading or some sort of keyword method. You find that statement, that passage, or they might say, well, what do you think the opinion of the author or the journalist is in this passage? And then you go off and do it, and hopefully you can get quicker and quicker. When you are practicing questions, don't use a book, because reading on a book is very different to reading on a screen. I mean this specifically when you're doing actual practice questions. But when you're doing the practice questions, definitely do it on the screen, because you have to get used to, you know, even just moving the mouse wastes time. There is sort of some people out there that have a sort of whiteboard method where you write down your keyword, but really you should be able to remember one keyword, you know, a date, a name, a place. And I think when I was looking up whiteboard method, it actually wastes so many seconds just, you know, picking up your pen, writing, putting it down and wiping it. So why not just store it in your brain, because that's the one thing you just need to focus on, that keyword for the 28 seconds you have per question. That keyword is everything. Finally, a common pitfall, don't leave any questions blank. Remember, there's no negative marking in the UCAT, thankfully, so answer every question, and remember that each question is just worth 1 mark. So as I say, pick your battles sometimes. You know, you doing that one question over 4 more easier questions, it's not weighted any differently. And for this section, you can score between 300 and 900, like most of the other sections. So finally, I just want to say good luck. The UCAT is very daunting to begin with. When you break it down and you watch, you know, hopefully this video, you check out We Are Medics UCAT, which should be at the description box below. You should be able to smash this. We've given you a whole range of little tips and tricks and ways to complete it, and hopefully it won't be as daunting. So good luck, I'm sure you'll smash it.